This is an interesting case of, well, we'll see what it is. But as always with HRCT, the first thing to do is get an idea of the distribution of disease. I think the first thing to say is this is certainly not a classical interstitial lung disease. Instead, what we have is what looks like big holes in the lung. But those holes, wherever you see a hole, all communicate with airways. For example, if we look down in this left lower lobe, look at this. This actually communicates with an airway. So what we in fact have got is bronchiectasis. Now, when we talk about bronchiectasis, remember, we're talking about dilated airways. The normal human lung, within the normal human lung, airways taper from the central to the periphery. And it's that absence of tapering which allows us to say on a CT scan that there is bronchiectasis. And that is a key cardinal sign of bronchiectasis. And you must have that absence of tapering before you can say someone has bronchiectasis. The other thing we talk about are the morphological types of bronchiectasis. So in its mildest form, we talk about cylindrical, which are essentially tubes, non-tapering tubes. We talk about varicose, and this does demonstrate varicosity. So this sort of slightly nodular outline to the airway. But then that melds fairly neatly into cystic, and that is perhaps the most severe form of airway dilatation. Okay, so we've established this patient has bronchiectasis, but in patients with bronchiectasis, there are often ancillary signs. Firstly, there is more often than not bronchial wall thickening, and you can see how some of the walls of these airways are markedly thickened. And that's because this is an inflammatory condition. The airway walls are inflamed. There are repeated episodes of infection, and this is something that patients with bronchiectasis suffer from. Another sign which I think is important to point out is mosaicism. You will have heard of the sign of mosaicism, and that's perhaps best seen by narrowing the window settings. And when I narrow those window settings, what you will see is that there are areas of black and white lung, which I'm sort of highlighting here. And those are a testament to the fact that there is often very florid small airways disease in these patients. And in all patients with bronchiectasis, there will be a component of small airways disease or mosaicism. So we have significantly dilated airways. We have mosaicism. We have some bronchial wall thickening. In other patients, you may see considerable mucus plugging. But this is a very classical appearance of airways disease that you see in some patients on HRCT.